everyone. I'm Lauren. I'm the programs coordinator at Gryt Health, and I want to go ahead and welcome you to Block 5 of today's Mental Health Summit. We've been having a great time. We're happy you've been joining us. So I want to go ahead and introduce the first session that's going to be taking place during Block 5. We have Dr. Krystle, who is a registered and licensed dietitian, and her session is titled Food and Mood. So we're going to be learning about some different food and mood associations. So again, thank you everyone for being here and attending Block 5, and I will hand it over to Krystle.
Well, thank you. My name is Krystle Zuniga, and today's presenters have discussed various strategies to support mental health. And in our short time together, I want to discuss the association between diet and mental health, a few tips on developing a nourishment plan, and we'll end on a practice of mindful eating experience. I will be answering questions at the end of the session, but feel free to drop them in as I'm talking. But first, I have a task for you. If you can, I'd like you to go to the kitchen and grab a quick snack. Like, I'm giving you a minute, so just grab anything. We're gonna need this for the end to do the mindful eating experience. Please bring it back on a plate or a napkin, but don't eat it yet. Okay, so you got a quick minute, grab anything. No rules. And if you have time, you can put in the chat what you ended up grabbing as a snack as we wait for other people to join back in. An orange, awesome. Another orange, all right, getting the citrus. Lauren's having almonds. Again, cake counts. It's awesome. Any food we're going to use for this experience. Awesome. We got a good variety of foods that we'll use at the end of this activity for a mindful eating. Well, thank you so much for running to the kitchen and grabbing something for this activity. So it is common knowledge that there is a well-established link between diet and physical health, especially for chronic diseases such as type 2 diabetes and heart disease. But what is less understood is that association between diet and mental health. Now, one of the reasons why I love nutrition is that every single cell in our body is dependent on what we eat. We literally are what we eat. But our diet is not only fuel for the body, it provides the building blocks for all of our cells and contributes the vitamins and minerals for those cells to function. So the production of signaling molecules like hormones and neurotransmitters, essential for brain function, are dependent on the nutrients from our diet. So just like the heart, stomach, and liver, the brain is another organ that requires adequate nutrients and fluids to function. And our brains will function best when it receives the fuel and the nutrients it needs for those complex cognitive processes and emotions. But what does the research say about how the food choices you make can affect your mood and mental health? There are now many observational studies that have reported an association between the quality of an individual's diet and their risk for depression and anxiety. Studies have demonstrated that people that have a diet that's high in whole foods, such as fruits, vegetables, nuts, whole grains, legumes, and healthy fats like that are in fish or olive oil, these individuals are less likely to develop depression than people who eat less of these foods. Similarly, a dietary pattern with a higher intake of foods with saturated fats, refined carbohydrates, added sugars, and processed foods have been linked to poor mental health. But I want to highlight here that these are associations from observational studies. This is not causation. And there are very limited intervention studies that have been able to look at a direct cause and effect between diet and mental health. And although this is very interesting research, these observational studies, and the field of nutritional psychiatry is rapidly developing. However, it's important to note that not one single dietary factor or lifestyle factor affects mental health independently. Rather, diet should really be part of this integrated approach to mental health that includes psychological, emotional, and social well-being. What I love about this Gryt conference is it's really looking at that interdisciplinary approach to mental health. So also due to this complexity, think it's important to be attuned to what your brain needs when it comes to nutrition for mood and mental health. So I challenge you to start by just paying attention to how eating different foods feel. Now, not just how they taste in that moment, but maybe how they make you feel a few hours later or even the next day. Try experimenting with a healthy diet for a few weeks, or even just adding one more healthy meal or healthy snack in your day. Reducing intake of processed and high sugar foods, and maybe replace them with more fruits and vegetables. And then see how you feel. If you feel more alert, are in a better mood, or have more energy, you might be on to something. But understanding that everyone has their own diet that works best for them. Okay. But also important to mental health is self-care. And nourishment is a form of self-care. And you need to make sure that you're fueling your brain and your body throughout the day. If you're under chronic stress or illness, for example, in cancer treatment and recovery, it becomes difficult to rely on those hunger cues to adequately remind you to nourish the body. Also, when you're busy or fatigued, it's really easy to miss meals with so much you are tasked to do or feel like you need to do in balance. So a couple of tips I have to better nourish yourself during these times where your hunger cues just aren't there is trying to aim to eat something every 3 to 4 hours. Have several opportunities throughout the day to have fuel for yourself with these multiple small meals. And I say to be prepared. There's going to be times where you're fatigued or really busy or overwhelmed, and those are going to be times where you have less time to prepare food or purchase food. So have quick and easy snacks or meal ideas available to help you stay nourished during these times. So what I like to do with patients is have them create like a nutrition 911 list. And I hope you've got a piece of paper or pen or maybe your smartphone next to you. And I want you to jot down at least 2 simple meals or snacks that you could prepare or pick up when you need to fuel your body. Okay. So give you a little time to just think through 2 things. And I encourage you to, after this, to try to create and expand this list a little more when you have some more time. Because when you're busy or fatigued, this is the time where your brain is not thinking logically or well. This is not the best time to be making those complex decisions around a meal. What's in the refrigerator? How much time do I have? What will the kids eat? Where do I stop? What do I order? What do I cook? Decision fatigue is real, and it is exhausting, and it will contribute to having poor mood as well. Like hangry is a real thing. Okay? But also on your list, these don't have to be elaborate meals. I see an example of yogurt with granola, a piece of fruit, egg, or fruit. Exactly. They can also just be large snacks, like a peanut butter and jelly sandwich, a handful of nuts with crackers, maybe a kid's meal at McDonald's with the toy. Okay. These are just some ideas, but consider it Nourishment 911. Leave on your fridge and save it in your smartphone for those times where you know you need to eat. Now you have a really condensed list. So I saw a note here that I'm so indecisive when it comes to what to eat. Yeah, if you've got a list, it's like, okay, it's out of these 4 things, I need to choose something rather than I can have anything and any store is available to really kind of limit those choices so that you can make a choice more quickly. I love the kids' meals too. See that note in the chat. Okay, so although we are learning more every day about the power of food for health and prevention of chronic disease, this developing field of nutrition has also fueled the evolution of fear-mongering, obsession with clean eating, cleanses, and a flourishing diet and supplement industry. Now, disordered eating patterns and eating disorders are on the rise in this country, and this is a direct threat to physical and mental health. Now, I support people pursuing wellness through improving their diet, but we really have to be careful about how this could evolve into anxiety, fear, or guilt around eating. And really a particularly vulnerable population to these food fears are cancer patients and survivors. Through books, blogs, support groups, well-meaning friends and family, The misinformation around diet and cancer results in patients terrified of eating, considering foods or ingredients poisons, toxins, or the like. Really, the pleasure of eating has been stolen. People become overcome by these food rules that are mandating what and when you should eat, regardless of preferences, needs, or hunger. These shoulds and should nots micromanage and dictate food choices instead of people learning how to trust their own bodies to make the right food choices for them. I use intuitive eating in my practice, which is based on body attunement. This is the ability to be in touch with what is going on in your body and honoring your body through engaging in self-care and self-compassion. This interoceptive awareness honors your health through paying attention to the messages that your body is asking you to do to meet both those physical and emotional needs. It's a practice, and it is something I can't even begin to give justice to in this brief talk, but I really encourage you to further explore these principles of intuitive eating for developing a healthier relationship with food. So I really want to end on a guided eating activity from intuitive eating. And this activity is a practice in mindfulness. So I hope you've got your snack available, because what we're going to do is something that I encourage you to practice after this, because staying present in your meal experience allows you to feel that direct experience of your body and the many sensations of eating. Cultivating your awareness and sensory experience of eating will contribute to your satisfaction in eating. So I encourage you to also do this at another time and a place when you can eat without me distracting you. But hopefully we've got no phones, no TVs around, and then we're going to focus on enjoying the snack that you brought in. So I'd like you to place your food on a plate or a napkin in front of you. Sit comfortably and take a couple of deep breaths until you feel relaxed and calm. Okay. So we'll start off with the first of sight. Without touching your food, notice how it looks on the plate or napkin. Gaze upon it with curiosity, as if you have never seen this type of food before. Notice the color, the shape, and any nooks and crannies and shadows. How would you describe what you observe to someone who has never seen this food? There's no wrong or right way to describe your observation. Just notice and engage your eyes. Touch. Pick up the food and plate it on your hand. Notice how it feels on your hand. Perhaps it is smooth, rough, sharp, crumbly, sticky, brittle, crusty, heavy, or light. There's no wrong or right way to describe these physical sensations of touch. Just notice and feel the texture. Sound. Take a small bite of the food. How does it sound as you take a bite? Perhaps crunchy, crackly, dull, slurpy, wispy. There's no wrong or right way to describe what you hear. Just listen and notice. Mouthfeel. Without taking another bite, roll the food around in your mouth and notice how it feels. Is the texture rough, crumbly, dry, sticky, moist, light, or something else? Resist the urge to chew the food. Just notice how the texture of the food changes as it sits on your tongue. Perhaps it's beginning to get soggy, to disintegrate, or to become stringy or sharp. No wrong way or right way to describe the physical sensations of food in your mouth. Just notice and feel the texture gradually change. And then finally, taste. How does the food taste? Perhaps sweet, sour, bitter, salty, pungent, or bland. What happens to the taste of the food as it sits on your tongue? Does it get stronger or perhaps more subtle and less distinct? Are new flavors emerging as the food dissolves on your tongue? There is no wrong or right way to taste your food. Just observe and notice that nuance of flavors. Next, chew your bite of food, and when you feel ready, swallow it. Notice how the food feels as it travels down your throat. Now, you don't have to go through this painstaking process every time you eat. But I encourage you to think of this practice as an opportunity to slow down and practice more mindful eating experiences, to really engage with the food rather than having fears and guilt or shame around your eating experiences. Although food is fuel for the body, food is much more than just fuel. It's an experience, it's cultural traditions, it's something that can support our physical and mental well-being. So I encourage you to really think and evaluate your relationship with food and to use food as something that supports rather than distracts from or harms your mental health needs. I am going to look at the Q&A if there's a good question, if I have some time. Oh, and I think I'm actually short on time. What's going on here?
Krystle, you can go ahead.
Okay, I think the Q&A is a little bit of personalized questions. So again, I don't want to give like too much personalized nutrition advice in this quick consult for everybody, but yeah, I did see some things come out about people stating that after treatment, feeling like fatigue or change in diet gets people panicked around their food, and absolutely that after maybe having nausea or vomiting after eating a certain food, it can be really challenging to try to reintroduce that food back into your diet when you're not on treatment or trying to feel better. And I encourage you to have patience with yourself. Again, those principles of self-compassion in that part of self-care. And it's okay to give yourself some time to reintroduce foods slowly at your own pace, little bites at a time, and to assess your tolerance over time. Someone said, I'm realizing the Cliff Bars I love look and feel gross. Yeah, kind of giving it another glance over. They taste good, but they might look a little weird. And like, how many times have you actually stopped and looked at your meal and noticed all the colors and the smells and really engage with your meal experience? So often we're kind of rushing around as well. For 3 years, someone says I couldn't eat the food that I ate during treatment. Exactly, and it can take some time, especially with taste changes that can be lasting even after cancer treatment. Food aversions are definitely a thing that can last for a while. Any other questions? Okay, well, I hope you at least got some time to have a little snack in this. How people, yeah, I'll go ahead and type in here how people can contact me. And I'm a dietitian at the Livestrong Cancer Institute in Austin, Texas, and I work with patients there. I'm also on social media at Z Nutrition and empathy-based practice, and try to demonstrate to my patients to have compassion also for themselves while they're going through this experience around food. Yeah, and I love that recommendation, Lauren, about politely turning down nutrition advice from people that you've got a practitioner, you've got your oncologist, hopefully reaching out to a dietitian and making sure that you're getting your information from reliable resources. People are well-meaning, but understanding that that type of information can really kind of swirl through your head as you're eating. And the more that you can limit those negative thoughts, the better. All right. Well, thank you so much. I'll go ahead and type my information in the chat, and y'all enjoy the rest of the conference.
Thanks, Krystle. That was great. I hope everybody enjoyed their snack and were able to really take in those tips for mindfulness. I know I did. I never knew how many crevices were in my almonds, so now I do. So Krystle, thanks again. And next up, we have our next speaker, Stacy Hurt, who is a stage 4 colon cancer survivor and a self-advocacy warrior. And I like to call her a total badass. but she's going to be up next, and her session title is Just Putting It Out There. So let's go ahead and welcome Stacy.
Hi, everyone. How are you? How's everybody holding up during this devastating, unprecedented time? I just want to thank you from the bottom of my heart for being with us today, being with me today. This time is certainly adversely affecting all of our mental health. And if you are one of my fellow survivors, if you're in active treatment right now, my heart absolutely goes out to you. And we're just gonna dig in and talk. I do not have, as I said on my social media, I don't have anything scripted. I don't have anything planned. We are just going to talk to each other. I'm going to tell you, let me give you a little bit of an overview of what I'm going to cover. First of all, I want to thank the great folks at Gryt Health for holding this worthwhile session, these ongoing sessions they've had, just jam-packed with useful info for those of us adversely affected by cancer. And I want to thank my friend Dave Fuhrer. He is also a badass. And Lauren, that is the highest compliment anyone could possibly pay me, is to call me a badass. So thank you for that. I embrace that with everything I have. And yeah, speaking of badasses, thank you, Dave Fuhrer, for having me. So anyhow, the first thing I want to do is tell you I'm coming from Pittsburgh, PA. And I would love for you to join in the chat. Tell me where you're joining from today. And I would like you to tell me something that comforts your mental health. And let me tell you what comforts me. I told you I'm in Pittsburgh, so I'm obsessed with the beach, of course. So let me show you, I'm having a cup of coffee, and my mug, if you can see it, says shell yeah. So go ahead and give me a shell yeah, all right? Shell yeah. Okay, awesome. What else do I have? Oh, I have my water in front of me with my mug that says, call me on my shell. Yes, yes, yes. Wait, there's more. My coaster says, the beach is calling. And it's gonna take a while, I know, until we're through the pandemic to call Stacy back, but I will be there. So all through my cancer battle, I surrounded myself with things that comforted me. And when I had security of certain little things, they improved my mental health. So this is very interactive, like I said. Let me go to my chat window. Let me see where everybody's coming from. Shell, I'm getting a lot of shell yes. Oh, I love it. Okay, we got Orlando. Yes. Previously Mount Washington, shout out, that's awesome. Upstate New York, Ireland, my goodness, Columbia, South Carolina, Greensburg, oh my gosh, I'm just feeling the love. People from all over, this is amazing. Oh gosh, this is just an amazing way for me to start out. I do still get dry mouth and dry throat from my treatment, so let me take a drink of shell, yeah. Oh, I love you guys. This is awesome. This is the closest I'm going to get to fulfilling my dream of having my own talk show. So let's lean into it. Okay. First of all, let me tell you a little bit about my story and why it's so unique. The most frequently asked question I get is, how do you stay so positive? And I'm going to answer that. I'm going to tell you my story, and along the way, I'm going to tell you some mental health strategies that I use. Feel free to adopt them, steal them if they're going to help you. And so I hope so. And then at the end, we're going to talk about some coping strategies. Okay, so let me tell you my story first. And as you see, nothing will shock or offend me. So keep those questions coming. Okay, I'm just laughing at the chat here. I'm getting so many shell yeahs, it's amazing. Okay, let me tell you my story. So I am born and bred Pittsburgh. I'm never leaving. And part of my story will tell you why. But I actually started my career in healthcare. I have 2 master's degrees from I'm undergrad Penn Stater. So yeah, we are. And then I went to Pitt for my MBA and my master's in health administration. So I actually worked in healthcare. I was in physician practice management. I was in pharmaceutical sales. I was head of training and development for a drug company. So my whole background and career is actually in healthcare. So along that journey, in 2003, our older son Griffin was born. And in 2005, our younger son Emmett was born. Unfortunately, Emmett missed all of his 6-month milestones, and we knew something was wrong. So we started with an MRI of his brain that showed it was completely demyelinated. It was completely white. And then we went for blood work, subsequent imaging. We stopped counting at 60 specialists, 60, to obtain a diagnosis for Emmett. And, you see, I love to laugh, but I've told this story 1,000 times, and every time I tell it, I get a little emotional, so bear with me. But we determined that Emmett has a chromosome abnormality. He has an extra piece of chromosome on his 1q chromosome arm. And the geneticist told us, your son will never walk or talk. Get used to it. In those words. I wanted to punch her. I didn't. But this has resulted in Emmett now being 14. He does not walk, talk, or do anything for himself. So he functions as a 6-month-old baby, and he's 14. So I have to lift him, diaper him, feed him, medicate him. He's up several times a night. And it's tough. It's very, very tough. And his diagnosis is one of 3 known cases in the world. You heard that right. There's a boy in Italy, a girl in England, and Emmett. So there's no roadmap, there's no playbook. And my husband also has his MBA, and that's where we met, was in grad school. And between us, with all of this experience in healthcare and all these degrees, we said, we have no idea what we're doing. And we're just going to make it up as we go along. And you know what I said to that geneticist who I almost punched? I looked at her and I said, we're going to make the best life possible for Emmett. And you better believe we did. And to this day, Emmett does way more than the doctors ever expected. And we're so proud of him. And so I have been advocating for patients since Emmett was born. He is my inspiration, and he's the reason I'm still alive. So fast forward to 2014, and I took some time off of my job to deal with Emmett's care and all his therapies, and he attends a private school now. And so I was dealing with all that. And then in 2014, something you should know about me, in addition to being, bold, is that I am athletic. I'm a non-smoker. I'm 5'11". I am thin. I take good care of myself. I'm a rule follower. And in 2014, I was having symptoms of abdominal pain, blood in my stool, fatigue. I was waking up, and I just said to my husband, I'm just not feeling like myself. And he said, go to the doctor. Well, I was traveling once a month for my job. I had all of Emmett's care, and I just viewed it as an inconvenience. So I finally went to the PCP, and she said, well, I don't think this is anything because you're so healthy and young. I was 43 at the time, but she said, I'm going to send you for a colonoscopy just to be sure. Went for the scope on 9/11/14, and the scope revealed a tumor so large that the GI couldn't get the scope around it to see the rest of my colon. He stopped in the rectum. He aborted the procedure, woke me up, and said, "You have cancer." And I said, "Cancer? How does that even happen? I do everything right." And he said, "It just does." And I was shocked. I'm still shocked that it ever happened. I had no family history, and other than my symptoms, no reason to think I would get cancer. So we went on another battery of tests, and I got a PET scan that revealed on my 44th birthday, September 17th, 2014, that I had cancer in 27 places in my body: rectum, liver, lungs, lymph nodes. I had a less than 10% chance of living 5 years. And when the doctor gave me my PET scan, when he told me what the totality of the situation was, I said, "Well, what are my chances?" And he said, well, he didn't answer me. He didn't answer me. I knew that was bad. He said, "I don't have a crystal ball, but this just depends on you and how you respond." And I said, "Well, if this depends on me, I'm going to tell you that I am going to kick ass." And that's what I did. But my first little mental health hiccup happened when I walked out of his office as we went to get our ticket for the parking garage, and I had a panic attack and passed out. Now, I really don't remember any of this, but my husband tells me that's what happened. And he said I just passed out cold, and he said the oncologist came running out and said, "What happened?" And I created quite a scene, apparently. But I had never had a panic attack before. I didn't know anything about them. That wasn't really something that I was used to. And they happened again, and I'll get into that. But that was my first experience with a panic attack, and it was hearing about my situation. So treatment. So I went into chemotherapy, and after 6 rounds of chemo, which was 5-FU, oxaliplatin, leucovorin, is that right? Yeah, FOLFOX. My tumor shrunk from 11 centimeters to 3. It was what they called an unprecedented response. And my treating oncologist really couldn't believe it. He said, "What are you doing? We got to bottle it and sell it. What are you doing?" And I did a lot of what Krystle talked about. I did a lot of nutrition things. Again, we can get into that. But you know, I just kept positive, kept looking ahead, focus, commitment, determination, head down, kept going. Did 7 more. I was deemed surgical. And at surgery, they added Avastin, and my tumor shrunk from 11 to 2. 4 of my 5 lung tumors resolved, and 1 of my liver tumors resolved. So it was awesome. So went in, got the cancer out, did more maintenance chemotherapy to the tune of 55 treatments total, and CyberKnife radiation on my remaining lung tumor. And friends, I am here to tell you, I am cancer-free. So yes, we can all clap for that, sure. Wait, ready? Shell, yeah? Okay, let's give it up, yeah. I'm having fun. I hope you guys are having fun, despite this heavy subject matter. But with any luck, I have a scan coming up in May, and I will be 5 years cancer-free. So I don't know if you pray, if you hope, if you shine, if you dance, whatever that is you do. If you could do that for me in May, I would deeply appreciate it. It means the world to me. So, you know, so here we are. And like I said, I had been advocating for Emmett since his birth and fighting insurance fights for him. And so I got into patient advocacy for colorectal cancer, volunteering for a number of organizations, Colorectal Cancer Alliance, Fight Colorectal Cancer, Colon Cancer Challenge Foundation, and I actually went to work for a year for the Colon Cancer Coalition. And so I was doing all this advocacy work, and I was on a retreat for the Colon Club. I was in their On the Rise magazine, and it's a long story that you can Google, but Southwest Airlines misplaced my luggage, and I wrote into Southwest Airlines to talk about the woman who returned my luggage and how gracious she was. And the story went viral around the world. It's a long story, like I said. And somehow that kind of thrust me into this spotlight of people saying, you have cancer, you look so good, you're so upbeat, you're so positive, like, how do you do it? And so that was when I created my website, stacyhurt.net, to kind of catalog my whole story and put up a bunch of tips and things that had worked for me along the way to bring me such fortunate success in fighting stage 4 cancer. So everybody always asks me, what was the toughest part of all that? I will tell you that I know a fair amount of stage 4 cancer survivors, and I know a fair amount of friends with disabled children. I am yet to meet someone who had stage 4 cancer as pervasive as I did, and a completely disabled special needs child, and do those at the same time. That was by far the most difficult part of my journey, was doing both of those simultaneously. And I remember I get choked up. My older son, Griffin, at the time, he was 10, and he asked me, Mom, are you gonna die? And I said, I can't die. I looked in the other room and I saw my husband changing Emmett's diaper and lifting him and everything. And I said, I cannot die. And hence, I credit Emmett for the reason I'm still alive, in finding my purpose to live and beat down stage 4 cancer. So, let me take a deep breath, have a sip of coffee, and let me look at the chat window. And let me see what questions that we have. Okay. Wow. You guys have a lot to say. This is awesome. Okay. I want to take a question that says, how do you deal with anxiety for the upcoming scan? Scanxiety is real, okay? And I have had, I couldn't even tell you how many PET scans I've had. And even my situation is going well. And I get scanxiety every single night before I get those scans. It never goes away. And in terms of, I was talking about mental health, I am not ashamed or afraid to tell you that I take Xanax every night, okay? No shame, no stigma, okay? I do a lot of coping techniques I'm gonna tell you about, but in addition to those, I do rely on medication. I'm not ashamed to tell you that. I take a teeny tiny dose. I take half of a 0.25 milligrams, so teeny tiny dose, but I take it every night to help me sleep and help with my PTSD. I do take one of those, even with my fasting, I do take one of those in the morning before the scan. That helps me. I do a lot of deep breathing. Might be good for all of us to do one of those now. I needed that. Do you need that? Show you. And I just basically try to visualize a positive outcome from that scan. I try to visualize the best possible outcome from that scan. And that is all of the cancer being gone from my body. And I've done that every single night since I was diagnosed. So Scanxiety is real. I just really, and everybody knows not to talk to me the night before a scan. Like my friends, my family, they don't talk to me because they know that I'm just in the zone. And as a matter of fact, I text my friends, I have do you know the little turtle emoji? And that signifies to my friends that I'm in my shell. I have a shell obsession, apparently, right? So, but no, so I hope that answered your question. I don't deal with it very well, to answer your question. Oh, you guys are so nice. Look at some of these compliments. Thank you so, so much. Okay. I do have a question about nutrition and gut health. And I do want to just bring this in really briefly because part of what I did, I have and this is on my website, but I had sort of a formula for how I faced cancer. And that is, and I speak about in some of my talks, does cancer make you antsy? ANTSY. And that stands for attitude, nutrition, treatment, support, and you. And to me, those are the 5 factors that help me beat cancer. For nutrition, I believe in evidence-based research. If I'm going to tell a patient something that I've done, I try to support it with unbiased information. And so the nutrition plan that I followed came primarily from American Institute for Cancer Research. If you want to write that down, AICR.org. I received that. I worked with a registered dietitian all throughout my treatment. I consulted with her day 1, and she was surprised. She said, Stacy, this is amazing. Patients usually ask me for a consult after they've lost like 25 pounds. And she's like, you're doing amazing. Why do you want to talk to me? And I said, because I want to take it to the next level. And she gave me AICR.org. So I incorporated a lot of on there. There's foods that fight cancer. Again, they're all data-based. And it was flavonoids from apples. It was carotenoids from carrots. It was cruciferous vegetables, broccoli, cauliflower. It was flaxseed oil. It was the red skin grapes has resveratrol. And resveratrol is known to cause cell apoptosis, cell death in cancer cells. So I could go on, but let me direct you to that website. I did all of that. And as well as I did cut out alcohol, I did cut out sugar. I didn't really eat fried foods to begin with. No sodium. I did not go keto. I did not go paleo. I didn't go gluten-free. But it was mostly plant-based, protein-rich from chicken, turkey, salmon, things like that. I ate very clean. And, you know, you have one body, right? And you got to use that body to fight both the cancer and the chemo and the treatments, right? So to me, it was making it as strong nutritionally as I could. So sorry that we're going off on physical health here in the mental health seminar, but it was very important to me for my mental health, because if I knew that I was doing all I could to be strong in my body, it made me mentally strong. So they sort of do go hand in hand, at least for me. Okay, let's talk about, okay, what am I, wait, there's so much. I'm trying, and I'm a horrible multitasker, so bear with me, horrible. Okay, all right. I can't keep up. So I'm gonna keep going, and hopefully I can, if you have a burning question, please type it in and I'll get to it. So let me talk to you a little bit about, again, some of the things, you know, that I did. I was a big believer in integrative oncology, and I worked with an integrative oncologist here at University of Pittsburgh Medical Center. Her name's Dr. Lainey Francis, and she told me about a lot of things with meditation, massage. I did yoga. I used essential oils. Essential oils, again, there's some loose data around frankincense. Again, you can Google, but I would put frankincense behind where right at the base of my hairline, behind my ears, on my temples, on my wrists, and on the soles of my feet, where there's the most receptors. And again, I'm just so into like a holistic approach to health. Like certain smells give me comfort. So I burn a lot of candles. Like I always have a candle on my desk. Certain smells, you know, center me. The frankincense smell certainly does. I'm seeing, yes, the peppermint oil, absolutely. I've used peppermint oil, frankincense, lavender, of course, to help me sleep in addition to the Xanax. And so I did a lot with that. I did try to move a lot during my treatment, even like when I was on treatment, because it would circulate the chemotherapy to the cells to kill them, and it would also help with detoxifying afterwards. So I always try to keep moving. Of course, I had to for Emmett, but I would even try to like get out for a walk or move as much as possible within treatment weeks. I know our tendency is just to be like, you know, just to like slug out. And I did slug out. I did sleep after I still have my port, you can't really see it, but you know, once I would get my medicine off of my fanny pack, I would try to move to try to detoxify. And another thing that really helps my mental health is music. So I have a song. You guys sign on because you have to listen to all my hokey stuff that I do. So I have a song that I play during every scan, and I played it when I was in with the oncologist who told me about my horrible PET scan. I play the song Gypsy by Fleetwood Mac. And there's something about that song that just kind of takes me to a different place, and it takes me away from the situation. And that's my jam. And so I recommend that to you. Find a song that takes you away from the moment and makes you believe that you can do this. That is my song. I'm telling you, every single scan, I'm like, I put Gypsy on. I'm like, I can do this. I can do this. I can do this. Oh, that's another thing I do. I do a lot of talking to myself. I know you're shocked, right? Because I talk so much, but I do a lot of self-talk. I mean, there were a lot of times that I was like, oh, you know, Stacy, you can do this. Stacy, you can do this. You know, anybody else will think I'm crazy, but I knew what I was doing. There was definitely something to that. I did forget a big part of my story. This reminds me of Gypsy. And that is I almost died during my surgery. I forgot that. When I went in for my surgery, he nicked a blood vessel and I lost half of my blood volume. And so he had to whisk me back into a second emergency surgery and find out where the bleeding was. And I woke up in the ICU. I saw a clock on the wall, so I knew I was alive. I'm like, there's no clocks like in the afterworld, so I must be alive. And so, yeah, so I took a little detour through the ICU for a week, but here I am. You can't kill me. No way. No way. Show you. So, what else did I want to tell you about? Some other things. So, I do want to talk about my anxiety and depression. And anybody that has cancer knows that it's really a roller coaster, right? I mean, you hear something, you're about to get those scan results, and can we talk about the fact that nobody understands how important a scan is? You try to tell your friends that your whole life depends on those scan results. And they're like, oh, good luck with your scan, you know, and everything. But you're like, oh no, you don't understand that those results are going to define everything. My plan, you can't even live outside of like 6-month increments. I mean, some of us at 6-week increments, right? And people are like, oh, I'm planning a vacation. I'm like, I don't even know if I'm going to be alive. Okay. Nobody gets that. We get that, right? We get it. And so The anxiety of the scanxiety, and then the deep depression, you know, when you look on social media and people are out partying and they're doing this and they're doing that, and you're home and you're depressed and you're just like, you know, because you're fighting cancer. Friends, I get it. I get it. I've been there. And again, how do we manage that? You know, online support groups are amazing. If you know, I highly recommend an online support group for your type of cancer. I know that in, you know, some of our online support groups for colon cancer, that they have, you know, trained navigators, patient navigators, who, you know, and they work with, you know, social workers and whatnot. But I do recommend the online support groups. I do recommend, you know, you talking about these emotions with a psychiatrist or a psychologist through your treatment center. Really, you know, I said this in my description, but being open and being vulnerable about your feelings and communicating them is really the best way to get them out, share them, and get the help that you need. I mean, I'm not afraid to tell you that, you know, there are days that for no reason whatsoever, I will just cry. I mean, I'll just like, my husband will look at me and be like, what is going on? I'm like, I don't even know myself, that I'm just overcome with my emotions. And, you know, yes, I'm fortunate to be cancer-free, but that cloud of recurrence looms large, okay? It is always there. And especially as a stage 4 survivor, I mean, I'm walking on the tightrope up here, folks. I mean, it, you know, and again, nobody understands that. Nobody understands that when you have cancer, you have it forever. You know, everybody's like, oh, are you better? You healed? You good? Okay, no. That answer is no. I'm not. I'm going to be dealing with this for the rest of my life. And that doesn't matter what stage you are. Once you hear those words, you have cancer, that follows you for the rest of your life. Again, I'm just here to say, I get it, and I'm with you. Well, you guys are just so nice. You're just sending me the nicest comments. Yeah, I mean, really, I just really want to share. Why don't you send me something else that bothers you that people say, and that seems to be a frequent topic in the chat rooms. You know, things that people say that bug you. Send me a couple of those, and I'll answer them in the time we have left. Oh, here's one. I'm recovering. When people ask me if I'm all better, and you say I'm recovering. Oh, I love that. I know, you know, I'm like, you know, I'm still here. I'm doing the best I can. That's what I always say. I'm doing the best I can, you know. Oh, here's another one. At least you got the good kind of cancer. Oh, like there's a good kind of cancer, you know, like, you know, don't you love people? What, do you have cancer? Okay, shut up. All right, you don't get it. I'm sorry. Dave's going to kick me off, I'm pretty sure. Okay. All right, here's another good one. Excuse me. No kids and now infertile from cancer. At least you can adopt. That's just heartless. I mean, that's just heartless. How do they know how you feel about, you know, children adopt? I mean, cancer stole from you one of the most painful dreams that you had, and somebody's seriously going to come in and give you, you know, a plan B. I am sorry that happened to you. I am sorry that happened to you. People are so senseless. Okay. Get over it, move on. Oh yeah, I know. That's another, you know, I'm just sharing these because I just really want to punch people. Okay. Oh yeah, this is the best one. You look great. You lost so much weight, you know. Oh, you look great. Well, again, oh, I have, did you guys ever see my infographic about the hidden disabilities? Because like I look great. Meanwhile, you know, I had poop cancer. I poop all night long. I have weird ways of pooping. I get I have neuropathy in my hands and my feet. You know, again, until you have walked in my shoes, shut up. You have no right. I'm sorry, get kicked off again. Okay. If I mention I don't feel good, I don't like when people say at least you're living. Oh, geez. You know, I'm just, guys, I'm just going to share these because I just want us all to know that we're in this together. A psych told me it was 10 years ago and I should get over it when I was talking about my PTSD. You know, I'm never going to get over my PTSD, okay? And now we're in coronavirus and it's flaring it, okay? I'm never going to get over it. Can we just tell everybody that, friends? We're not going to get over it. Zip. Okay, thank you. Okay. Or when they mention, yeah. How about when people say, when they talk about your situation and you say what kind of cancer you have, and they say, oh yeah, I lost so-and-so. My so-and-so had that kind of cancer. They died. That doesn't help, really. That doesn't help at all. And you know, let me just make a comment about that too. Something that really helped me, you know, when I had, you know, when I got my diagnosis, and I had a friend who gave me really good advice, and that is, don't look at statistics. Just stay in your cancer lane. Your battle is unlike anybody else's. And the way that your body is going to handle this is different than anybody else's. And I always used to tell people, somebody has to be in that 10% that lives. Pick me. Show you. Okay. Okay. Oh gosh, you guys are great. Look at all this sharing. Look at all this sharing. I want to like catalog this and just like write a blog about it. See, I love to talk about poop because I had colon cancers. I wasn't sure if all my pooping was stress, too much coffee. I'm always talking about my poop. Up with poop, my friends. Do you know that poop and blood work tells your whole life story? Okay. So there's no shame, no stigma in talking about our poop because that tells our whole life story. Oh yeah, that's my great-great-grandma died from your cancer. Thanks. Okay. You don't act like you have cancer. You are happy. Yeah, better than bawling. Oh yeah, I got you 100% right there. You know, well, what am I going to do? Curl up in the fetal position and just like feel sorry for myself? I mean, I got stuff to do. I mean, it's either like move on or sit in the corner and bawl. I mean, this is what we have to do. We cancer people rock. Can you just go ahead right now and just wherever you are, just tell yourself, I am awesome. All right, let's do it. I am awesome. All right, we are badasses. That's right. Nobody gets it. Jeez. Yes. Yeah. You know, you can, and that's the other thing too. If you're watching this, you know, and I'm sort of open to an extreme. I get it. But you deal with your battle, journey, experience any way you want, okay? It is nobody's business how to handle this, what you have to say, what you don't have to say, who you have to tell, who you don't have to tell, how you're supposed to feel, how you're not supposed to feel, okay? You do you, baby. You do you. And that is what makes us all unique and wonderful, is that we can face this any way we want to. Don't ever let anybody tell you how you should feel or shouldn't feel, or I did this or whatever. You do you. Absolutely. Well, I'm wrapping up here in 2 minutes. Again, I hopefully we can somehow look back on this chat. There's so much you guys sent, and you know, I want to tackle it. Just in the 2 minutes that we have left, gosh, I hope that I've made this worthwhile for you. If nothing else, you smiled, okay? And you know how just how we're all in this together. I know that's used a lot right now, but that we're all feeling the same things and that it's okay to feel those things. And if I can help you, you have my contact information, reach out to me. I'm happy to help. I'm happy to do another talk show installment. And I will be on the 30th moderating a panel for Carium Cares, Carium on Twitter, about young adults facing cancer. Please join me for that if you want more Stacy. I feel bad for you, but I'm going to wrap up here. I got to do it one more time, guys. Show yeah to you, because you are awesome and I love you, and just hang in there and stay strong. All right. Mwah. Love you.
Wow. Thank you, Stacy. That was incredible. I don't even know what to say. But I will say I did go run in my room because I have a shell yeah for you that I found in my closet because I live in South Carolina. We eat a lot of boiled peanuts here. And during a promo at one of my favorite restaurants, they were giving out boiled peanuts, and I got this shirt. Peanuttiest fan, shell yeah. So I had to go run in my closet and find that for you. Sorry for that side note, everyone. That's just what we do at Gryt. It's live, it's real. We are who we are. We're weird, we're fun, we cry, we laugh, we do it all here. So again, Stacy, thank you so much. We loved it. That was great. Loved all the comments. Amazing. And like I said, total badass. Hello. So I hope everyone can gather some of that energy and really, work on that and take that with them and, listen to those words. And, you might start somewhere, but you never know where you're going to end up. And you just got to keep on moving forward, and Stacy's more than a great example of that. So thank you. Next up, we have Megan Clare doing her session. She is a cancer survivor, blogger, and patient advocate. She was recently established as a true influencer on Twitter, unlike myself. So that's super cool. And she is going to be talking a little bit about her writing that she does. Her session is titled Feel and Heal. So let's go ahead and welcome Megan Clare.
Can we get a shell yeah again for Stacy Hurt? That was just amazing. I just have to say that. Okay. So my name is Megan Clare Chase. I am speaking to you as Warrior Megsy. As I'm speaking, feel free to interact and type any thoughts if anything resonates with you, and I'll give a little time for some questions and feedback. All right, here we go. How many of you have been struggling with your quality of life? And also, how many of you are upset or heartbroken, feeling depressed or stressed due to your lack of quality of life? Well, that's what led me to start writing and blogging about my life on the cancer train, which is the name of my blog. I had stage 2A invasive lobular breast cancer. I was diagnosed 2 months after my 39th birthday. And after chemo, multiple surgeries, radiation, I had a lot of side effects and permanent damage. I am now infertile and medically induced into menopause way before my time. I have fibromyalgia. I have neuropathy in my hands and feet. I have a bulging disc and slight tear near the nerve in my back. And I discovered in January that I have 2 benign lesions on my spine that now have to be monitored. So all of these things have happened. My body has aged so rapidly after treatments, and you start to wonder, why am I still here? You can get in a really dark place. And I couldn't really verbalize that to anyone, especially after my active treatment was over, because I was under that same illusion, as I'm sure many of you have been, that once you beat cancer, that your life will return back to, and I hate to use the word normal or new normal, but that your life will return back to the routine that you used to know. and my life has not returned to that at all. Because of that, I found it difficult to talk with people verbally because I would get so emotional or have difficulty finding the words, thanks chemo brain, or I just did not want to deal with it. There is post-traumatic stress after going through cancer, or if you're still in active treatment, or if you're in treatment for the rest of your life. There's just something very traumatic about the whole cancer experience. And a lot of people don't talk about that, especially regarding your mental health. And so for me, in order to get these feelings out, because it's not good to keep all of this built inside, I had to find some way to release all of this stuff. But then the fear comes that if I talk about this to anyone, then no one is going to understand, or even some people in cancer land don't understand it, because every experience is a little different because every body is different, right? And so for me, I really wanted to have that positive attitude. When I finished active treatment, I was going to be the poster girl of breast cancer. That's what I was going to be. I was going to do all these walks. I was going to wear pink ribbons, everything. Life was going to go back to what I recognized. And when that didn't happen, I thought something must be wrong with me. No one on my medical team, no one prepared me for the possibility that things would not return back to my routine pre-cancer. And so it was a huge blow for me mentally, emotionally, and of course, physically. I see others in cancer land running marathons, doing triathlons, climbing mountains, and all of these epic things. And I'm thinking to myself, I can barely walk to the kitchen without crying. What's wrong with this picture? And so I really started to doubt myself. Maybe I didn't do all the things I should have done in active treatment. Now, it's really important to not should on yourself, you know? And so I recognize that was a big struggle. So since I couldn't verbalize any of this, I just started writing. And a lot of people have asked me, why did you start your blog? And did you expect it to be read worldwide? Absolutely not. I never ever think this way. Anytime I write a blog post or a journal entry, it's all about gauging my mental health. How am I doing at this moment in time? Now, I do have a writing routine for blogging. I wake up typically on a Sunday morning and write it. Then I marinate for the whole day over it. I review it before posting Sunday evening. I get ideas throughout the week or through social comments, social media comments, or things I've read, or even dreamed. So I've essentially always been a writer. I always have a pen and paper handy because I like to write things out first rather than immediately typing. Sometimes if the neuropathy is too bad in my hands, I'll record my thoughts and transcribe it later. The minute you start writing for likes, comments, or clicks, you lose your authenticity. The only reason I post a lot is because maybe my inner monologue might help someone else not feel so alone. It's so important to release these feelings because sometimes depression, anger, or anxiety can hit you gradually or suddenly. The veil of emotions can become really thick, so it becomes harder and harder to think, but somehow when you just start writing, sometimes waves or layers of any pent up stress or negative feelings fall away. I try to make my writing as authentic as I can with no filter, and I think that comes across in my writing. be true to yourself. Now, what I'm going to say next is really important. Are you ready? We must be able to give ourselves permission to be angry, sad, or depressed sometimes. I'm going to repeat that again. We must be able to give ourselves permission to be angry, sad, or depressed sometimes, because so many think that once you've been through cancer that you must be on top of the world. You survived it. You're still standing. Well, the reality is kind of a slap in the face for some of us. And for those who are able to do those marathons and do those things physically, is fantastic. And in no way am I saying that's not fair, because again, every body is different. And that's the crazy part, is none of us know how our bodies will recover. And we absolutely cannot compare ourselves to others. And for me, my quality of life is probably 35% right now. And I really struggle with that. So because of that, I have a lot of anger toward my treatments. I have a lot of anger toward my medical team because they took care of getting the cancer, but not making sure I had what I needed to take care of my mental and emotional health. I'm angry about the lack of financial resources for those post-cancer. I'm in pain 24/7. Don't let this fascinator fool you. I never thought surviving cancer would continue to be so expensive. I often feel very alone. And even when you happen to be married, I'm single, or you have siblings, I'm an only child, or you have kids, I'm infertile, but I had my cat, Nathan Edgar. Cancer can still be very isolating, right? Therefore, going through cancer can take its toll on you mentally, because it's really hard to express these feelings without feeling guilty for sometimes just not being happy-go-lucky. And you know what? It's okay. I think we've all heard the Pollyannas of the world saying, "You'll be fine. Just be grateful you're alive." Or the classically overused, "Just be positive." You can think as positive as you want, but when you're alone or in the middle of the night and your pain level is reaching a level 14 and you're doubled over crying, you're not thinking, "I'll just put a smile on it." That's a Band-Aid response. And for me, in writing my feelings out, whether anyone reads it or not, is therapeutic. There is something magical and cathartic seeing your thoughts written down. It can be just a word, a sentence, or pages of thoughts that are yours. No one can tell you how you should feel. No one. This is your story. As a society, we tend to celebrate only the positive feelings and repress negative or scary feelings. Well, your mind can only repress those intense feelings for so long until one day you unintentionally explode on someone you love over something trivial. That is why I am a big believer in feeling every emotion, but having a time limit on my pity party. I feel it, I write about it, and then I release it, either by closing my journal or posting it on my blog. Now, some days can be too overwhelming, and I realize I need to take things 15 minutes at a time. In fact, some days it's 5 minutes at a time, am I right? Why? Well, you can feel overwhelmed or disappointed that you didn't accomplish all the goals you had for that day. Even when you push yourself Sometimes your body just can't keep up with your mind, and that's a tough pill to swallow. The complexity of our emotions can ebb and flow and either drain us or fulfill us. Going through cancer seems to automatically arm us with an emotional resiliency that is needed to keep moving forward. Writing your story is something everyone should consider. You can write it simply for your eyes only. You can write it to give to your significant other or your kids one day. You can write it and submit to publications and write a book. The point is to write. When you go back and read things written weeks, months, or years ago, you'll see how your thoughts and mindset have changed, or see a pattern of things you need to work on or work through. Now, I want to read something really quick, and it really has inspired me. It's called "Your Trauma is Valid." Even if other people have experienced worse, even if someone else who went through the same experience doesn't feel debilitated by it, even if it could have been avoided, even if it happened a long time ago, even if no one knows, your trauma is real and valid, and you deserve a space to talk about it. It isn't desperate or pathetic or attention-seeking. It's self-care. It's inconceivably brave. And regardless of the magnitude of your struggle, you're allowed to take care of yourself by processing and unloading some of the pain that you carry. Your pain matters. Your experience matters. And your healing matters. Now, the healing process is a lifelong journey. Make your words part of your legacy. Now, oh my goodness, look at all of it. Look at that. Oh, I'm reading all this stuff in the comments. Let me see what's going on here. Oh, thank you. Yes, I will definitely post a copy of the Your Trauma is Valid by Danielle Copley. It's fantastic. I definitely would love to keep the conversation going because it is so important for you to really feel all of your emotion and feelings. Through my blog, Life on the Cancer Train at warriormegzi.com. Or you can reach out to me on Twitter or Instagram, and my handle is @warriormegzi. Thank you. Oh, thank you, everyone. Oh, look at these comments. I'm just pleased as punch. Uh-oh, I'm getting Southern now. I'm getting punchy. Yeah, try to keep the accent out so you pay attention. A standing ovation. Oh, thank you. Thank you so much. Well, I hope this was helpful. And just remember that all of our stories matter. We matter.
Thank you, Meg and Claire. That was amazing. Session 5. Wow, just wow. So you can move on to block 6. You can exit out of this session. And then if you're on your computer, you're just going to scroll down and hit the join button on block 4. And if you're on your phone, when you exit out of this, you're going to want to go ahead back onto the conference website, grytmentalhealthsummit.com, and rejoin so you can watch block 6. A lot of great stuff coming up. So head on out of this one and join us over there. Thanks, guys.